Hello friends, welcome to Creative Medicine. In this lecture, we will learn about a young female on antidepressants presents to the emergency with altered sensorium and hypotension. ECG reveals wide QRS complexes and right axis deviation. What is the next best step? Here the patient is on antidepressants and then the patient has developed wide QRS complexes, right axis deviation and hypotension. So this is actually a tricyclic antidepressant. On overdosage, it will lead to cardiotoxicity. So if this tricyclic antidepressant overdosage leading to cardiotoxicity, the treatment in this case is giving IV sodium bicarbonate can be given. So after giving IV sodium bicarbonate, this IV sodium bicarbonate is mainly used if QRS interval is prolonged because this can reverse the toxic effects of tricyclic antidepressants. Okay. Thank you and thank you for watching.